Measles reported today in connection with the 9 current cases in Oconto County. Those 9 cases, of course, identified over the weekend, as you know, they can all be traced back to a single source contact out of state. The Oconto County Health Department yesterday saying there's no risk to the public. The Department of Health Services said they don't believe there is a high risk of ongoing community spread. But county health departments are now on alert as Wisconsin has become the 41st state to report measles cases. Brown is one of 6 neighboring counties surrounding Oconto County. And we welcome in Katrina Nordyke. She is a Brown County Deputy Health Officer. So let's just first start with this. What went into motion in Brown County when you heard the news over the weekend that the measles had been found in Oconto County?
Well, we are always prepared to get reports on communicable diseases. So that's an ongoing readiness that we are waiting for. We get notified from healthcare providers, or from Wisconsin Department of Health Services. So when we heard about the potential for cases in a neighboring county, we looked to Wisconsin Department of Health Services to see if they are pulling together a team, if we are involved or not involved. And then we usually will expand our education to the public.
Okay.
Let people know what we can let them know.
Right.
Again, reiterate our messages about vaccination, protecting yourselves and your family, and then sharing what information we can.
We know that in Oconto County, obviously they start contact tracing and they do all that, which you are also prepared to do. But is there any communication immediately with Oconto County to see if any of those folks may have traveled into your county?
Yes, certainly. If there are cases that are confirmed, once they do that initial case contact investigation, they would let neighboring counties know directly, or even other states if they had to.
Okay.
If they found that there were contacts out of that county or out of that state, then they would involve the other health departments.
So how are you involved in tracking potential disease, in this case measles, in the community? What kind of things are you now watching? If those folks had already been in Brown County, you would have been alerted. That apparently has not been the case. So what things will you be monitoring, to see if measles does show up here in the county?
Right. We're always surveilling the community for potential communicable diseases and other issues. So, of course, we look to cases confirmed. We see that through our healthcare providers, local and other counties. We also hear from Department of Health Services if things are going in other counties. And then in terms of surveillance, Wisconsin Department of Health Services wastewater surveillance.
Okay, so that does work for measles. We heard a lot about that during COVID. Yeah.
Yep, that they're monitoring for COVID and some other respiratory illnesses, as well as measles now.
You mentioned in your first answer, you're always prepared for this. There's always a level of preparedness. There are preparations. There are scenarios that you run through. So what do those look like? How does that training, what would that look like to us?
Sure. Well, we have been preparing for outbreaks ongoing, but especially with the draft, the NFL draft that we just had here in Green Bay, we intensified our efforts and our training around outbreaks.
Okay.
And so one of the things we were thinking about was measles, because we knew it was happening in other parts of the nation.
Sure.
We held training exercises where we ran through what it would look like if case 1 showed up at the draft and ate dinner at this place, parked at this place, saw this game. We ran through a specific scenario internally, but also with other regional partners, local health systems, infection preventionists, other health departments.
One of the things that's come up with this case is that we're a month out from school starting. So how involved are school districts in these kind of preparation planning scenarios?
They're invited to those planning exercises, but also we hold and facilitate monthly meetings with local and regional partners, including our school health systems, where we look at communicable disease surveillance ongoing. So every month, whether there's an outbreak or not, we're talking about what's going on in the community, what are people seeing, what should we be looking out for. That's the way that we share information and resources across the region. And so they're invited to those meetings, as well as local healthcare providers, infection preventionists, long-term care facilities, other folks in the area that are stakeholders if we were to have an outbreak. But in addition, we work closely with the schools for their immunization reporting. So we talk to them ongoing, and especially now around this time when their kids are going back to school, seeing if they're prepared to collect that information, seeing how we can help, letting them know when our vaccination clinics will be, if they want to share that with their families in their districts.
Vaccines. I know Milwaukee County had ordered extra vaccines this year, I think up to 500 doses. How does Brown County handle that?
We routinely have vaccination for kid clinics every month.
Okay.
And so we provide those routine vaccinations, including the measles, every month for eligible kids and their families. And then in addition, we do hold a certain number of adult vaccinations as a regional hub, and that includes the adult measles vaccination. We are routinely stocked with the MMR as well as other vaccinations, and then we work closely with Wisconsin Department of Health Services to maintain our supply.
All right, Wisconsin Department of Health Services, put out their vaccination rates. The CDC last week was talking about vaccination rates among kindergartners. So you've done a lot of preparing, you have a lot of plans in place. Is there anything that concerns you now that you know it's in the state? And is it in fact vaccination rates? What are they here in Brown County?
Well, we would like to see our vaccination rates higher, of course. In Wisconsin, we could do much better in terms of kids and the routine vaccinations. We sit around 86%.
Okay.
What we know is that herd immunity requires 95% of the community to be immunized. And so for those individuals who are either too young to get a vaccination, including the MMR vaccination or other vaccinations, or potentially can't get the vaccination because they're immunocompromised or other reasons, folks who can get the vaccination really should speak to their medical provider to see what's best for them in terms of being fully vaccinated to help prevent not only that disease, but also illness in themselves, people around them. That goes for the schools too. If a child is sick, that affects the teachers, that affects parents who may need to go to work, having to take off work, so the consequences can be widespread.
All right, Katrina, thanks so much for taking the time and educating us about this. We appreciate it.
Thank you.